Assalamu alaikum and welcome to the program Ramadan for Better Health. We hope as we approach the end of the fasting month that you have been successful in your efforts. Inshallah, we will have life for another fasting month next year. Tonight's a health topic. We're going to be talking about facial surgery, plastic surgery on the face. We're joined by a plastic surgeon. He also works as a professor of plastic surgery here in Cairo, Egypt at Al-Azhar University. Assalamu alaikum to you, Dr. Mustafa Mikki.
Wa alaikum assalam wa rahmatullahi wa barakatuh, Mr. Ali.
Yes,
Nice
thank
to meet
you again for being with us. May Allah accept our efforts in the fasting month. We want to talk about facial plastic surgery on the face. Can you please talk to us about what are some of the causes, the main causes why patients come to you asking for plastic surgery to begin with, and then once you perform this, what kinds of changes they can expect?
Okay. I will start by quoting the Holy Quran, a statement or ayah. بسم الله الرحمن الرحيم يا بني آدم خذوا زينتكم عند كل مسجد وكلوا واشربوا ولا تسرفوا إنه لا يحب المسرفين. So صدق الله العظيم. So it is instruction from our God that we have to keep always beautiful and to be in good health. Regarding your question regarding the facial changes or that cause the patients to come to the plastic surgery clinic, and
Yes.
what are the solutions for these problems. The first cause for facial changes is aging or senility.
Okay.
You know, with the progress of our age, there are some changes in the face, like for example color changes of the some color changes in the skin, maybe due to exposure to the sun and other things. And also there may be some sagging of the or dropping out of the face or the facial skin. The forehead will come down. Patients may have some frowning of the forehead or some lines on the forehead. She or he may have some sagging of the malar area or the cheek. Also, they may have some jowls. And those are the main changes that occur and cause the patient to come to the plastic surgery clinic to have some beautification.
Dr. Mustafa, you caught yourself. You clarified and said that you have both male and female patients.
Of course.
Okay. So what is the breakdown? We imagine that more women than men, but you said that aging is the primary cause in both cases, men and women?
Of course, with the aging occur in both, but in female it occurs more earlier.
Okay.
Because of the hormonal changes of their body. You know, the area is the age of menopause, which occur around 45 years old. There is withdrawal of the menstruation, and there will be reduction of some hormones that may expose those patients to have some sagging of their body or some facial changes, so they age more earlier than men. So most of the patients that come to the plastic surgery clinic are women than more than men.
And you talked about hormonal changes with the onset of menopause. Some women and men, I imagine, they take extra, they ingest more supplemental hormones.
Yes.
What effect does that have? Does it postpone the onset?
Yes, this is hormonal therapy that is taken after the age of menopause, and also it delay the process of menopause, and also it will render the patient more or less beautiful for a longer period of time than it will happen when there is no treatment.
Now, how do they get these hormonal? Do they have to work with a doctor like yourself, or can they buy them?
No, of course, she has to go, or she has to consult her OB-GYN doctor. I mean, a gynecologist, to take this hormonal treatment, because if she take a big amount of these hormones, it will have a problem and complications, because some of these hormones, if it's taken by high percentage, it may expose her for cancer of the uterus.
So she needs to be careful with
of course,
this.
of course.
Work with her doctor. Okay, so now you have your patients, you've done your screening, you've gotten their history, you approved the procedure. And talk to us about the actual procedure itself.
Okay, We may have some procedures that can be done in the clinic, I mean in the office. I mean that is not that doesn't require operating theater to do or to improve or to do some beautification of the face. And also we have some procedures that require operating theater. Regarding the procedures that can be done in the operating room, this includes the forehead lift, the eyelid, I mean what's called the blepharoplasty, face lifting, and also we may have neck lift. The eyelid surgery or blepharoplasty, it can be done through an incision here under the eyelashes, hidden scar. We have to remove this redundant skin and miscolored or discolored skin, and also we may have remove some buffness of the lower eyelids that occur with the process of aging. Also, we may do some forehead lifting, okay, to correct the sagging or dropping of the forehead. We may do facelift by doing incision here in front of the auricle and also behind the auricle to take the face or the sagging face up. And also we may do some sort of liposuction for removal of some jowls in the neck, and also to may do incision here to remove some excess skin. Those are the procedures that require operating room and require maybe general anesthesia for beautification of the face. But actually recently there is introduction of non-invasive procedures, and it works well, especially with the patients that have starting or beginning of the aging process. This include Botox injection, for example. This may include filler injection, and also injection of vitamins, or what's called the mesotherapy. And recently we have introduction of a new method for correction of sagging of the face, which is called the Aptos or feather threads.
Aptos or feather threads.
Yes.
All right. Before you talk more about this, I just want to go back to a question. What percentage of your patients have to do with cosmetic surgery, and what are for the purposes of after experiencing trauma and accidents?
Actually, it depends on the modernization of the country and also the economic standard of the population. In developing countries, we have a lot of reconstructive surgery more, because those patients, they have little, you can see, economy or economic standard, and also those patients are more exposed to trauma. Okay, but in developed countries or the countries that have a lot or I mean the good economic standard, they may do mostly cosmetic surgery. But and also it depends on the, I mean, you can in the same country you have some modern areas and non-modern areas.
That's right.
We have rural and urban areas and something like that.
In every country there's an elite class that can afford these things and are concerned about them. Okay, so let's continue to talk about feather threads.
Yes.
What are feather threads?
Feather threads, those are threads that are intended mainly, as we can see here. They are four kinds of threads. We have wire, we have threads, we have spring, and also we have mesh.
This is the black piece there?
Yes. Those are inserted under the skin. Under the skin, as we can see here, we have to inject the local anesthesia first, and then we have to insert the threads in the subcutaneous tissue between the layer of fat and the skin area. And these threads, after implanted down in the undersurface of the skin, it will contract. It has some hooks at it can be shown later in another photos. As you can see, it has some spikes. Okay, we call it bugs. Yes, as we can spikes. Yes, this is implanted under the surface of the skin, and we have to do dragging. It will take the face up. It's like hooks. It do hooking of the undersurface of the skin and take it up.
Okay.
So this is
So it's not just by the tension of pulling. You actually have microscope or small instruments that pull the skin from under the skin itself.
yes,
Mm.
yes.
Mhm.
It's like that, mostly like that.
Okay, so these are feather threads. Aptos, are they the same thing?
It's called aptus. The terminology aptus come from the word, you know, ptosis. Ptosis means sagging or dropping down of the
Yeah.
facial skin
Mm-hmm.
and the neck.
Mm.
Okay, aptus means atosis. If you insert the threads under the skin,
Mhm.
it will correct the ptosis that appear or happen in the face. I mean the facial skin and subcutaneous fat.
All right, Dr. Mustafa, we're almost at our break. Before we take a break, please talk to us about, are each parts of the face equally correctable, or are there some parts that are more correctable than others?
So, as I said in the beginning of this session,
Mhm.
the areas that appear sagging or dropping of the face
Mhm.
include the forehead,
Mm.
the cheek area,
Mhm.
the jowls,
Mhm.
and the neck.
Ah.
So those are the areas that are amenable for correction by the threads
Mm.
or aptose threads.
Okay.
So
All right. Thank you very much for answering these questions. We'll continue to our discussion about facial surgery with Dr. Mustafa after a short break. Assalamu alaikum and welcome back to the program, Ramadan for Better Health. We're talking about plastic surgery on the face. We're joined by a plastic surgeon, Dr. Mustafa. Before the break, you were talking to us about these feather threads. Can you continue talking about the feather threads and distinguish? There are other tools that you have,
yes.
fillers, and we hear a lot in the news about Botox. Help us understand these different tools.
Okay, I will start with Botox.
Mm.
Botox, it is a material that is extracted from a specific kind of bacteria.
Mm-hmm.
And this is used to be injected in the muscles or expression muscles.
Mm-hmm.
If we inject this material in the expression muscles, it will remove some undesirable emotions. Like, for example, if we have forehead wrinkles, for example, if we inject the Botox here, it will remove these wrinkles. Also, we may have frowning or some frowning in the face in this area by Botox. Also, some lines in the neck can be injected by Botox, and also the Botox can be used for some sort or some problem of excessive sweating in the palm of the hand and also the axilla. This is Botox.
Botox.
Yes. Filler, it can be injected to augment or to augment some depressions on the face, like this nasolabial fold, and also if the patient if she has some atrophy in the face, it can be injected. Okay.
The material of the fillers is
filler.
It's
it
different
is a
from
normal material present in our subcutaneous skin or subcutaneous tissues. It's called hyaluronic acid. So we have to inject this material to augment or to correct the atrophy in the face or some depressions on the face.
Okay.
We have also what's called mesotherapy or multiple vitamins that to do some rejuvenation of the face. And lastly, we have the thread or aptus. As I said, it is a specific threads that can be inserted under the skin to correct some sagging or dropping of the face, as it can be shown here in the as they showed it in the screen before.
This photograph of a they'll put the photo back up for us in a second here. So these are some of the different instruments that you have. The vitamins, can you say more? Is this a cocktail of different vitamins or a specific kind of vitamins?
Those are specific kind of vitamins that nourish the skin, and also the vitamins that correct the color changes of the skin, and also it does some nourishment of the skin, like vitamin A and some minerals and vitamin E and so on.
Okay.
It's manufactured by some companies, and those are the threads as it can be seen here. This is a specific kind of thread which is called spring. This spring, it can be inserted under the skin, okay?
Yeah.
And it will shorten the facial chin, facial skin, like that, to take it up.
Yeah.
Like that. This can be injected, inserted in this area or the malar area of the cheek.
So on the top, we see the instrument that's used to insert, and then the close-up of the actual springs, or is that what
I
we're
think
looking?
we have some videos, but I think they didn't illustrate it.
Okay, all right. So this gives us an idea of some of the tools that you use. Can we talk a little bit about some of the precautions? Are there some risks involved in this?
Actually, insertion of thread is simple procedure that can be done in the clinic, in the office, without any problem. Patient or client, he or she should be in a normal health, and she would like to have some improvement of her facial or do some beautification of her face.
Yeah.
And we do it under local anesthesia. In the office, we inject some local anesthesia on the face, and we insert it under the skin like that, and we take it up. So there is no specific requirements, or there is no specific precautions that we are using or we are dealing with when we are doing a big surgery like liposuction or abdominoplasty or even facelift, because as these other kinds of operations require OR. This is what's called the wire. It's also a kind of aptus that can also be inserted in the deeper area of the face to take it up, especially this area, and especially the eyebrow and also the neck.
And if we get a close-up, like does it also have those spikes, the hooks?
Yes, these hooks will take the skin up, will be implanted in the undersurface of the skin, and it will take it up.
Got it. Okay. Now, after these, I imagine these are not cheap. They're not low-cost things. So people spend money on these, and after they do this, they want to be successful, right?
Of course.
So after the surgery is done, are there things that they can do that can disturb what you've done? When can they resume normal activities, or is there a time period when they need to refrain from certain things?
And actually, when these threads were invented, it was it cost a lot higher, but now it's more cheaper because there is another companies introducing another brands of this thread. But as you said, the patient spend money to get benefits,
right?
And also if he has a problem, he may blame the doctor for that. So we have to give clear instructions for our patients to refrain from doing patient insertion of the thread. And also, as I said, we have to select our patients. If the patient have little sagging of the skin, she will get good result. But however, if we have a patient with massive sagging of the face, massive sagging of the neck, she needs facelift or neck lift or other methods of treatment. After insertion of the thread, which is inserted under local anesthesia in the clinic, we have to give instruction for our patient: don't eat or drink hot food or fluids for 24 hours. And also, she doesn't have to do massage or massive movement of the face, massive expression of her face for 3 days.
So she can't watch, or he can't watch any comedy films that they're going to be laughing a lot, or
he has to avoid that. He has to be avoided from that. Especially in the first 3 days, until this thread the body will undergo what's called fibrosis. The fibrous tissue from our immune system will push some fibrous tissue to catch the thread to be implanted well in the skin. So in the beginning of the 3 days, or at least 1 week, he has to avoid expression movement of his or her face. He has to avoid excessive massage of his or her face. And also he has to know he can recur to his work from second day, it depends on his work, of course. He can go for his work on the second day after insertion of the thread, but he has to avoid this or anything that render this thread moving or يعني moving under the skin.
So they have to be careful with the environment that they're in, you know, and the people that they're around that have an impact on them. You know, if they have this surgery and you know they change their facial structure for too much, they could undo or have a negative impact on. Wow, I didn't realize that. What about people who live in very hot climates or the opposite, very cold climates? Is there anything that they need to be aware of? Do they eliminate or not perform these procedures in extreme temperatures?
Of course, if you have in a very hot climate, it will not be good. Because, as I said, we have to give these threads around 3 days to be implanted in the skin. Hot fluids and hot environment and hot weather will delay that. And then we may lose the thread. It may move under the skin. It may come out from the implanted area under the skin. So it's better to have, I mean, cold weather, to drink cold fluids. He doesn't have to eat cold, hot food and something like that.
I see. Got it. All right. Now, hopefully, inshallah, if someone decides to do this, they've paid money, they're expecting good results. What kinds of difficulties, challenges, or complications might you, during the procedure, or might they face in, after it's done?
Any procedure may carry some sort of complications. But as I said, if we select my patient very well, if we did our procedure in a sterile environment, and if the patient is stuck to the instructions from the doctor very well, he will have a good result. But we may have some sort of ecchymotic changes in the face. I mean, it's like skin discoloration from implantation or from breaking down of some capillaries under the skin. It may continue for 3 or 5 days, something like that. And we'll ask our patients post-operative to put some sort of cold fomentations to avoid that. We will describe for them some creams for this ecchymosis, and also we'll give them antibiotics for 2 days or something like that after operation. But very little, or minority of the patients, we may have some complications, like the thread may get out, or it may do infection.
So it's a very small percentage.
Yes, very small percentage.
This is okay. Now, doctor, we have run out of time. We've got about 1 minute. I'll give you to summarize, with all the information you've given us.
With the increase of age, we may have some sequelae of aging. We may have some non-invasive procedure, which is common nowadays: Botox, filler injection, vitamins, minerals. Also, we have the thread. But before all of that, we have to keep our body in good health by eating healthy food, balanced diet. We have to do exercise. We have to have fasting. We should have good heart, good health, everything. Thank you very much.
All right. Well, thank you very much for being with us to explain this topic, plastic surgery of the face. This is Dr. Mustafa Mickey. He's a professor of plastic surgery at Al-Azhar University in Cairo, and he's also a practicing plastic surgeon. And the final note is that prevention is much better than cure. So he's urging us to prevent entering these situations to begin with. Thank you for tuning in. We hope it was beneficial for you. And again, inshallah, may Allah accept our efforts during the fasting month of Ramadan to live again for another, inshallah. Thank you for being with us. Assalamu alaikum wa rahmatullahi wa barakatuh.